Hello, welcome to the channel and thank you so much for watching this video. I really appreciate everyone who engages with me and my content. And if you are liking what I'm putting out, please do hit the like button and subscribe to the channel. Every single person who does so is a real boost. But either way, if you do or not, I really appreciate everyone, so thank you. So today's question is, what is a back spasm? What can I do about it? And why do we get them in the first place? Now, this is something that we see quite a lot of in the office, and it takes people by surprise because they can be extremely painful. It's not uncommon for people to head to casualty and that sort of thing when back spasms kick in, because they do cause panic, because they essentially immobilize you. So it's a really good thing to be mindful of and to explore a bit what's going on. Now, the purpose behind a back spasm might surprise you somewhat. It's actually a protective mechanism. It's a mechanism by which your unconscious mind sitting up here can immobilize your lower back and spine if it detects a real or perceived danger. Now, the reasons for that are manifold, okay? All sorts of things can feed into it, but I always think of the three types of stressor that we can have in life. The first one being toxic, the second one being physical, in no particular order, and the third one being mental and emotional. Now, if there is a spike in each one of these, all of them, or any one of them, it can start triggering that brain to think, actually, we might be in trouble here. And so it can leave you susceptible to back spasms kicking in. Now, the next question is, well, what is the actual thing that's causing all the pain? Well, any muscle in the body can go into a spasm. It can, given the right circumstances. If we're talking about musculoskeletal lower back spasms, the most common culprits are muscles that run up and down the spine there. And then we have, called the erector spinae, and then we have little muscles in between the vertebra called the multifidus. Now, their usual job is to stabilize the spine, but obviously in this case they're stabilizing the spine to the point of immobility. Other muscles that can be involved, the quadratus lumborum is often involved. That's a big trunk rotator. It's a really big muscle, actually. Further downstream in the glutes there, we've got the piriformis muscles as well, and that can often cause sciatica if they start going into a spasm. But usually it's a combination of all of the above. And like I say, it's not a comprehensive list, because any muscle in the body can go into a spasm, and you'll never know exactly which muscles it is and which muscles it isn't. But the reason is the same. It is that unconscious mind triggering a protective response to try and stabilize that spine to prevent further injury or insult to your nervous system. So now we know the kind of the reasons that you could be susceptible to this. We know the muscle groups that is actually causing all the pain and discomfort. We know it's extremely painful, but we know the reason behind it. So the next question is, well, what on earth can I do about it? And again, the answer might surprise you a little bit. We have to switch that nervous system from fight and flight mode into rest and recover mode. One of the best ways of doing that is breathing and diaphragmatical breathing. Now, it's really important with this not to panic. If you do start panicking and you do start going to casualty and all the rest of it, it feeds into the panic feedback loop that's triggering all this in the first place. So take a pause, you know, self-evaluate. If you're not in real and actual danger, then you can have some time to think this through and see if you can get that switch to flick to rest and recover mode. Now, there are a couple of caveats with this. If you're getting a lot of really funny shooting pains down the legs, then seeking medical advice is no bad idea, okay? There might be a deeper injury going on. And if you're losing bowel or bladder control, that's a medical emergency. So again, seek medical attention. But if you take a pause, you self-evaluate, and you realize that actually it is just these muscles going into a big old spasm, then you can do something about it. So breathing then. Breathing is one of the best ways to turn that dial from fight and flight mode into rest and recover mode. But not just any breathing, we need to do diaphragmatical breathing. And to achieve that, as we take a deep breath in, we need that stomach to come out. And as we breathe out, we need that stomach to pull in towards the spine. Breathe in, stomach out, breathe out, stomach back in. Think of your lungs as balloons, and as you're filling the balloons up, your stomach needs to expand to give those balloons room to expand into. And as you exhale, you can pull everything back in again and expel all of that air. It's a really nice way of starting the process of getting that brain and nervous system to relax, which is what we need to get rid of back spasms. Now, when it starts easing a bit, then we do need to encourage movement back into the system. So a really nice way of doing that is pelvic tilts. So if we're standing up nice and tall and imagining our pelvis as a bowl of water, we're tipping that pelvis forwards. So water is coming out of the front of the bowl and coming back to the middle, and then tipping water out of the back of the bowl by tipping the back of our pelvis up. And then you're just rocking from side to side, trying to tip that water first out of the front of the bowl and then out of the back of the bowl. Now, don't push through pain or anything, but if you can do that even a tiny bit, that will start to encourage movement back into the system, and that will speed up your recovery and a resolution to this. Further down the line, when everything starts easing up even more, it's important to start moving that whole body, but don't force yourself into anything. So gentle walking is by far the best remedy for this. Walking in and of itself is quite a rotational movement, which again can have a big alleviating effect for all of those lower back muscles. Further down the line, a day or two later, when everything is feeling better again, then we can start looking at some stretches and reasons that this happened in the first place. But to get you out of the woods, those couple of things will really help. And stay hydrated.